don't think I expected to piss this many people off this quickly, so let's just get into it, and that is Suboxone and dental damage or dental decay. I've had a lot of people in my comments shouting that I'm hurting my patients, I'm destroying their teeth, I'm not counseling them on this really important issue, I'm causing catastrophic dental damage in my patients. I just first want to start by saying that a lot of people with substance use disorders have had really traumatic experiences in healthcare settings and with healthcare providers. They have felt like they weren't taken seriously, that they weren't prioritized, they were treated less than. That's a very real thing, and a lot of the work I do with patients early on is helping them to build trust in healthcare providers and healthcare settings again. And so I just want to put that out there, that for a lot of patients, just seeing a doctor talk about addiction treatment can be triggering. Now, Suboxone and dental damage. In January 2022, the FDA put out a warning that sublingual buprenorphine products, that includes drugs like Suboxone, can cause very serious dental damage. And that's a real thing, and patients should be counseled on that. Now, across the board, when I start a patient on Suboxone, their dental health improves. And I want to talk more about why that is. First, when people are in patterns of substance use, they oftentimes are not engaging in routine primary care or dental care. Most of the patients I see have not seen a dentist in many years. A lot haven't even seen a primary care doctor in many years. And so by stabilizing their lives, helping them stop their pattern of dangerous and harmful substance use, they're able to re-engage with those really important services like common dental hygiene practices. Not just seeing dentists, but a lot of my patients aren't routinely brushing their teeth. And so that's a huge intervention for people that is really helpful. The next thing I want to point out is that most of my patients today smoke fentanyl. And in order to smoke fentanyl, you have to heat it up until it vaporizes. And those very hot vapors are directly damaging to enamel and gums. And so just the process of smoking any drug, whether it's methamphetamines or fentanyl, damages teeth in enormous ways. And that's not even touching on the adulterants that are currently in the drug supply. Here's just a small list of some of the drugs we're finding in the drug supply. In my area, we routinely find pesticides and plastics in the fentanyl my patients are smoking. We are also finding drugs like BTMPS. If you don't know what that is, that's a sealant usually applied to boats to protect against UV damage. Now, people are heating that chemical and smoking it, which is destroying their teeth. Let's talk about why Suboxone likely causes dental damage. And that has to do with its pH, and its pH is low. It's about 3.4. Suboxone is acidic. If you let any acidic substance touch your teeth, it can damage enamel, it can damage your teeth. For some context here, Sour Patch candies are about 2.8 to 3 pH, so they're more acidic. So if you were dissolving Sour Patch candies in your mouth multiple times a day, that would be more harmful to your teeth than Suboxone. It's not no risk, it's an important risk, but it means my patients should engage in more regular